Hi everyone, and welcome to the blended course for child adolescent health during emergency setting. And I will be discussing with you today the second module, which is assess and prioritize. And I'm so privileged to be part of this program and the collaboration between the emergency program and the child adolescent health department in the regional office. And we thought of this program long time ago that we need to include child adolescent health as one of the most vulnerable groups in the emergencies that's been affected by emergency, and how we can systematically include them in our emergency response. So I will share with you from the perspective of the emergency program, how we think of including the child adolescent health within the emergency operations, and how we make sure that there is a good collaboration between the both area of work, that the emergency and the child adolescent health in that perspective. My name is Osman Elmahal. I work as a team lead for surveillance and response monitoring in the regional office in the emergency program in EMRO. And I'm so happy to be here with you today, walk you through this module, which is the second module regarding assess and prioritize. So you're all aware from the first module about the guide that we developed jointly, which is the operational guide for child, adolescent health in humanitarian settings. This is an attempt to organize ourselves and to help the people on the ground who on the forefront of the response, how to coordinate and how to make sure that we are synergizing our work in order to make sure that we're providing the best services for the child and adolescent during emergencies. So as you know that there are four modules, and we'll be working with you in this module, the second one regarding assess and prioritize. We will see together how the guide provide guidance for the field worker and for the frontline staff, how to engage in a coordinated way to pick up the priority for child adolescent and address them in a systematic way. So the four interconnected programmatic actions of area of this operational guide, it is how to coordinate and how to assess and prioritize, how to respond, and then how to monitor and evaluate. So this is the main for the areas that the guide help you to go through. You discuss in the first module, the coordinate, how to make the linkages between the child adolescent health people and then emergency people, how to make sure that they are interconnected and they are talking to each other in streamlining their effort together. In this module, we will go further a little bit and try to see how we can assess and prioritize. What that means, it means how to obtain data on child adolescent health via the need assessment and use them to prioritize the actions. So it's the main purpose is to pick up the needs and the gaps regarding child and adolescent health during emergency, and how to inform the decision-making process, to inform the response, for the planning, how these are the priority for child and adolescent during emergencies. So we had, as you can see in the guide, this is just the table of content of the guide, and you can see that we do have the coordinate and assess, prioritize, response, and monitor, evaluate, and there is a lot of references, and it is that we thought of having this guide to be much more operational one, help people in the front line to have enough resources that help them to implement. So in this module, assess and prioritize, we'll be discussing three areas. And then there is resources and tools will be also annexed in this chapter. Will help you. You can reflect to them later for further reading. But for this training, we will be discussing inclusion of the child and adolescent health in the initial assessment, and we see how we can include them. What are the domains need to be covered? What are the areas need to be addressed in order to systematically include child and adolescent health in the response operation? Then we'll discuss how we assess the existing resources and capacity. What do we have at the community level, at the government level, or at the international level? What are the resources and the capacities that we have in order to cover those needs? And then the third one will be how to prioritize. Once we identified the gaps, once we identified our resources, then we will help us to prioritize what are the priority intervention that need to be implemented in order to give the maximum effective and efficient intervention at that level. So this are the element of our discussion today, and we'll go through them one by one. So as I mentioned that this module is focusing on all those 3 areas, and at the end of the module you will have the resources and tools how to use that you need to use it during assess and prioritize part of that one. So if we start with the first one, which is inclusion of the child and adolescent in the initial assessment, how we can do that systematically. And this is an output of a long discussion between the expert and reviewing a lot of document that's being used both at both sides, the humanitarian part and also at the child and adolescent part. What are the assessment methodologies and assessment tools, and how we pick up information regarding the gaps and needs in emergency and also at the child health, and try to synchronize them both and to come up with something that help the frontline people to talk to each other in a very conducive way. So as you see that the humanitarian cycle, that is a status preparedness, then you respond, then you prepare. So it is a iterative cycle that you need to do this kind of preparedness and responding. So you start usually with the need assessment and analysis to identify what are the problems. Then you go for strategic planning. Then you mobilize resources for your plan, and then you implement and monitor how you are doing your implementation. And then you do some sort of evaluation to get the lesson learned, and then it feedbacks again into this need assessment. And it is a iterative cycle. So you're not going starting with the same place. Each time you were expecting to have better understanding, have better knowledge, have better improvement. Definitely humanitarian emergencies are complex and chaotic, and it is very unexpected, but the concepts are the same. It is always follow the same. We manage them with the same concept, with the same approach. So key agencies should have some sort of the coordination of this need assessment. In the start of whatever is happening, we need to have that kind of coordination and making sure that everybody is aligned and included into that one. So we need to assess how the situation may evolve. We need to identify the gaps in the response, and then also to assess the operational constraints that hinder the implementation of the agreed interventions. It is easy to say, but I believe me, it is sometimes difficult to do on the ground because a lot of partners will be working in the ground. So we need to have a full understanding of who do what and how we can cooperate. And I think this is what's covered in the first module. But in this module, which is the first step to implement, it's how to work together to have this kind of joint assessment, picking up the needs and the gaps, identifying the problems, and then come up with the priorities. So conceptually, the assessment, we can consider it can be divided into 2 main domains: how to assess the crisis impact and how we assess the operational environment. So those are the 2 main conceptual framework that how we can divide the assessment. If we focus in the crisis impact, in the crisis, we do have also the scope and the scale of the crisis itself, and then the condition of the affected population. So those are the 2 main pillars that help us identify, understand, and contemplate what is the impact of this crisis. So the scale and the scope of the crisis, we will looking for the drivers of this crisis, why it happens, and what are the causes, what are the primary and secondary effect, what will be the consequences of this event if it happens, and what will be what are the underlying factors that cause this event to happen. So this will help us understand what is the scope and the scale of the crisis, why it happened, what are the consequences of that happening, and what are the underlying causes. This in general tell us the humanitarian profile of this crisis. We need also, at the other hand, to look for the condition of the people affected. This crisis happened, it has effect on the population. So we need to have a better understanding of the population situation that affected by this crisis. So the first one, we need to look for the humanitarian needs of those population, the vulnerability and the at-risk groups, and then what are the physical disruption and infrastructure disruption that happens. So we are looking the effect of this crisis on the population, which is called the severity of the crisis. So those are the 2 main dimensions that help us understand what's happening in the crisis. So, for example, if an earthquake happens in the middle of nowhere in the desert, it will not have an impact in the population, because there is no population, there is nothing to be affected. But if that's the same earthquake happen in a densely populated population, so the impact will be huge, because it will affect population and have impact on that population. So here you can see the difference. We need to see the magnitude of this and the scope of the crisis itself, the hazard itself, and then the effect on the population. So this help us articulate the impact of the crisis. The other side of the story is not the operational environment. And in the operational environment, also we do have two issues to address in the assessment. What are the capacities and response, and what are the humanitarian access? In the capacities and response, we're looking for the national level and the local level response capacity. We're looking for the international capacity, and also we're looking for the community capacity. Those are the three layers of the capacity. And the first one in the community, that there will the agility and the resilience of the community to absorb and to accommodate the hit of that emergency. Then the local and the national capacity to respond, and then the international support if it is possible to help them. So we need to understand what are the capacity in order to elicit the gaps in the response operation. Then the humanitarian access, we do have the capacity, but sometimes the access to this capacity is affected. Sometimes we do have access of relief actors from outside, it's affected. Sometimes it is access to population affected, so that we are not physically able to access these services, or sometimes due to physical or other security constraints that affect. So all operational constraints that hinder the affected population from accessing the resources that is available. So this is just a conceptual frame to help us contemplate what kind of assessment we're looking for, what are the dimensions, what are the perspective and the angles that we're looking to see. This is overall will be affected by the projection of the future, what will be the likely evolution of that one, what will be the priority humanitarian needs from that one. So we need to have a careful, coordinated assessment of the situation and ongoing monitoring of the response, because emergency is not static, it is very dynamic. So we need to have the ability to update, to monitor the evolution of the emergency and the interaction between the hazard itself and the population being affected by this hazard. That change over time, sometimes very rapid changes. It depends on the nature of the hazard itself, but it changes, even if it is long, kind of chronic hazard or chronic problems, that also it change over time. So we need to have the ability to change our method and capture those changes in those dynamicity. So the need assessment, we're looking for crisis impact and the operational impact, as described here in this slide. The discussion, as I mentioned, while developing this guide and the document review for this guide, we come up with 10 elements or 10 principles for conducting the needs assessment. If you want to do this needs assessment, you need to consider these 10 elements. I know that we can't refer it to the guide for more details, but here are the 10 elements that you need to make sure that there is a national leadership. It is not just a parachuting from outside supporter, international agencies or whatever to do the assessment. There should be a national leadership with all experiences proving that this is the cornerstone and for any sustainability or effective intervention at the national level. And so this is the first step you need to consider. Then assessment need to be done prepared during preparedness phase. So we need to have preparedness planning, incorporate assessment in the emergency preparedness plan. So we start the response during that preparedness, prepare our document, prepare our assessment tools, prepare our methodologies, train the people. All this need to be done during preparedness phase. Then we need to think of data utilization, build assessment on existing Carlos and his data, like the demographic surveys prior to assessment and report. So better utilization of existing data, it will help us contemplate, make sense of the data that we're collecting during response. Then we need to make sure that it is aligned with monitoring. So ensure the linkage between the assessment and ongoing monitoring, because as I mentioned earlier, that the crisis and the emergency always dynamics, it changes over time. So we need to make sure that the assessment is up to date and updated, and it is kind of monitoring system rather than just a snapshot of one kind of assessment. The number 5 is the data relevance. How we make sure that the data collected is directly feeding into the decision-making process. We're not collecting data for the sake of data. We're collecting data for the sake of decision-making process. So we're looking for the decisions. What are the decisions required? I need to mobilize that kind of resources. I need to open this facility. I need to provide that kind of service. So in order to have that decision, what are the information that I need to have? So to make that linkages, it's not just about collecting haphazard data. It is just need to make sure that it is serving the decision-making process. In emergency, we need to have that kind of information to support decision-making process. Then number 6, we need to make sure that it's inclusive approach. What does that mean? It needs to involve all stakeholders working on the ground in this area, utilizing whatever technology is available, social media, engaging young group, whatever, that we are having inclusive approach, because the policy or the principle is not leave no one behind. We need to make sure that everybody, especially the vulnerable groups, are well addressing in our response. Then this is linked with the next bullet, which is address group, address priority of needs of specific groups such as gender, age, disability, unaccompanied minors, ethnic minorities. We need to have a closer eye and a specific eye addressing those at-risk group, because they are prioritized because of their high vulnerability and at-risk group. Then we need to have clarity regarding the information management, how to implement effective information management regarding the data collection, correlation, storage, sharing, analysis, and sharing, and making sure that the loop is closed with feedback to the people who are providing the primary data, in order to have a closed cycle of information management. And the thing that need also to be considered, we need to have a clear understanding how the context analysis and the situation happening in X country will be different from that country. So we need to be very aware of the context and include it in the analysis to make sense of this data. So the context orientation is very important in the need assessment in that one. And also the last one is to have the long-term perspective. Conduct assessment with an eye in the future regarding the recovery and how we contribute the health services in the future. So these are the 10 elements which come as an output from the discussions and the desk review we did for developing this guide. So I'm not going to spend a lot of time in this one, but this is just to show you the coordinated assessment and phases in humanitarian cycle. So it is based on the Interagency Standing Committee operational guide. It goes with the complexity. There is phases of this assessment. Phase 1 is a preliminary scenario definition. It goes with the complexity to the right, and then with each time you add more tools and more methods to kind of assessing the situation. So the second phase could be you include the HIRAMS, which is health resource availability monitoring system, which is widely used during emergency, give a lot of data about the service availability. We also use the early warning and alert response system. We're using also the post-disaster need assessment. So these are kind of tools. It depends on the complexity of the situation. You add more tools, and it depends on the time. For the first few days, you have this easy tools, but one things evolve and being a little bit subtle, maybe after a few days you include other tools and so on and so forth. So we need to make sure that in each of these phases, child and adolescents are well represented and well addressing all these kind of humanitarian emergency assessment tools. So the role of child adolescent health working group and individual agency in the assessment, we do have three parts to be addressed. We need to make sure that there is active participation of the working group, ensure that children and adolescents are counted in all these assessment I mentioned in the previous slide, even in the initial phase or even in the midterm or even in the long run, they are well represented. And we need also to include the age disaggregation, because each age group has their own challenges and their own vulnerabilities. So we need to make sure that this assessment take care of the age segregation and the vulnerability in that one. And then the last thing, we need to integration of broader needs assessment and activity, child health adolescent within the broader assessment that are well addressed. There are specific child health vulnerability at risk. You may be all about that, but the guide describes some of them, that younger children less than 5 years old, the girls, the unaccompanied migrants or accompanied separated children and adolescents from ethnic or specific ethnic or religious minority populations, children and adolescents with disability and chronic health conditions, child and adolescent caregiver or primary income earners, child and adolescent in armed forces and combat and justice system, children and adolescent in forced or expoliative labor, including sex worker. This kind of specific group within the child spectrum need also to be specifically addressed. So it's not you need to have this kind of granularity of the assessment to pick up those kind of specific at-risk group in the child spectrum. So issues to be considered, these are just examples. I don't think this is an exhaustive list, but these are the main issues that we think of we can gather for that could have consequences for the children: the violence and trauma, the food insecurity and undernutrition, disease outbreaks and controlled endemic diseases, mental and psychological well-being, gender issues, and the age issue. So these are the main issue that the guide consider after the discussions of the experts and the reviewing document. Those are the elements of the assessment that people need to consider when we are conducting this kind of assessment. So here in this slide, we'll try to walk you through some of the common data collection methods after the review we did for the documents and the discussion with the expert. These are the kind of data that are tools and mechanisms to collect the data, and we have comment for each one. So I will try to walk you through them very rapidly. The first one is the Inter-AS Standing Committee Multisectoral Initial Rapid Assessment, which is GFMER tool. And this is GFMER is a coordinated approach to overall assessment of crisis, not only for health. It's led by the OSHA, so it is looking for all other sectors: security, nutrition, health, or all other sectors. And health will be leading the health part. The health sector will be leading the health assessment part of that one. There is a second one, which is the mentioned previously, which is the HIRAMS, which is the WHO specific, and it's a tool for initial assessment for the ongoing monitoring of human resources for health, and it is used by the health cluster also to tell us what are the service availability in the area after the emergency. There is also another tool called the SARA, which is the WHO Service Availability Readiness Assessment. It is more robust compared to HIRAMS. It's quite intensive to collect the data, but it is cross-sectional. It gives you just a snapshot what is happening. So it is a kind of a survey that is you do to identify what are available services. But if you compare it to HIRAMS is more like a surveillance kind of approach. But it provides a quick and dirty data. But SARA have more detailed data, cross-sectional, but it is just a snapshot for that one. There is also another tool which is called WHO Rapid Risk Assessment. The Rapid Risk Assessment Guide, the initial rapid assessment, which is very quick, and during the first hours of your first days of the emergency, give you a quick hint about what's happening. There is also another tool which is the Early Warning and Response System, EWOS, and it mainly focusing on how to pick up the disease outbreaks and whatever public health threat that is emerging. It can quickly identify what's happening. If the surveillance system is not working very well, early warning system could be established to help us as a public health responder to pick up what are the problems. There is also the 3Ws, 4Ws, or 5Ws kind of a tool. Those tools try to help us identify who do what, where, and when. So it asks the W's questions, because it will look for we need to coordinate, we need to make sure that to avoid duplication. So this kind of tool help us identify who do what, where, and when, and in order to have better coordination with that one. There is also a tool which is called the STAR, which is a strategic tool for assessing risk. It helps the country or the area to identify, to prioritize the hazard. It's an all hazard approach. It gives us ranking for all the hazard that is possible to happen, and then giving the rank for that one. So flood is the top priorities, followed by outbreaks, followed by earthquakes. So these are the priority hazard. It ranks those priorities to help us develop our contingency plan based on the risk profile of the country. There is also smart nutrition assessment, which is a rapid method for nutritional emergency. So these are the most famous, you can say, kind of tools that can be used, and each one has its pros and cons and used in different ways of methodology. It is good to know about them. It's good to know how we can engage and make sure that the child adolescent are well invested, well addressed in those assessment. So the key actions in the need assessment: we need to review data. Members of the working group need to review with the OSHA risk profile, the all hazard and response plan, make sure that the data are representing child adolescent health very well. Then we do some sort of context assessment, contribute to a systematic, objective, and ongoing assessment of the context and stakeholders. So the child adolescent health working group coordinate the input, advocate for disaggregation of data by age and sex, use the pre-existing data as much as possible. So it will act as a subject matter expert in order to make sense of the data will be collected and how this could be linked with the prioritization data. So then we will assess the safety and security, focusing on children and young people to identify threats, violence, and human rights violation. Consider using the child protection and rapid assessment toolkit, so to include the child domain into those assessments that mentioned in the previous slide. Then definitely considering the gender impact and making sure that rules and norms and stereotyping affected children and adolescent experience are well addressed. And then the most important part is sharing the finding widely. Use multiple communication channels to ensure the information is circulated to the people who are in need. Because as I mentioned in the previously, we're collecting this information to link it with the decision-making process. So it's not about just assessing and having just understanding for what. So it need to be linked information for action. It need to be linked with the decision-making process at a different level, community level, local level, national or international level. So the key success indicator for this phase is that the health cluster lead agency has conducted an initial rapid assessment with active involvement of child, adolescent, and working. So if we achieve this, then we consider that our assessment process is inclusive of the child, adolescent health in the emergency. All these tools and all these procedures and all these questionnaires and all these methodologies, well addressing the child problems, disaggregated by age, disaggregated by gender, considering these minority groups within the child domain, addressing their needs and their gaps, and other will addressed. The second part will be now we consider that inclusion of the child adolescent health in the assessment, now assessing the existing resource and capacities. And this is the rapid assessment offers preliminary understanding of need and response capacity, and to gain more comprehensive review of the health cluster, and the working group should conduct an in-depth assessment of health service and resource capacity. We need to understand what are the capacities, what are the resources we do have. The working group need to be working closely with the health cluster people in order to ensure that what are the you have a clear understanding what are the resources we do have in the emergency. For here, we do have a couple of action-oriented interventions. First, we need to coordinate the child adolescent health assessment. The working group coordinate additional child adolescent assessment in collaboration with the health cluster lead and information management group. So we need to work with the health cluster lead and information group to make sure that our questions and our ask and our surveys are well included in those methodology. Then we need to review the policies and protocols and to avoid duplication and conflicting recommendation with existing programs and protocols. Then we need to facilitate government and NGOs communications through UNF if necessary to make sure that we are all on the same page. There is no contradiction, there is no duplication. And we need to make sure that we are updating our guidelines and updating our tools and based on this assessment. So review and update the clinical guidelines, the health promotion materials, and the training tools based on the information we received from the assessment. Then we need to always ensuring the collaboration and that everybody is on board. And the second action point, that the health facility assessment, mapping of existing facilities, assess the capacity, the child adolescent services, them maybe by using HIRAMs, SARA, the 3Ws or 4Ws or field tools, whatever tools are available to make sure that those health facilities are existing, where are existing, what kind of services they're providing, what kind of child health and adolescent services are available in which facility. Then we need also to evaluate the staffing and competency of essential services for child adolescents. Doing this mapping, also we need to assess what kind of human resource, what kind of training, what kind of capacity they do have, and document the number of skilled health provider and the facilities. We also need to look for the medication, what are the access to medicine and supplies, what is the availability, where, how much, and if there is any issue with the supply chain regarding in this area. Then we create a service map to help the decision making in identify what are the hotspots or other areas that we feel there is a gap regarding maybe there is facility is not functioning, or there is facility but there is no staff, or there is facility and stuff but there is no medication. So we need to pick up what are the problems. So need to have this kind of mapping to help the decision making in mobilizing resources to support that. So to consider this part is successful, there are two indicators to measure that. The working group has prepared a plan with the health cluster lead to conduct additional assessment for child adolescent health and response capacity. The plan includes the timeline for effective activities and designated responsibility. So based on information we collect from the initial information for the assessment, we need to have a more close look or zoom in or more granular assessment for a specific area, and then link with the planning that how we can rectify these gaps. The working group also has helped health cluster lead to create and disseminate service maps. So we, at the end of the day of the assessment, we need to have a clear understanding what are the service availability, what are the facilities that are functioning, what kind of human resources are available, and this will help the decision-making process in pulling resources and providing it into the right place. So the elements of the service map that, as I mentioned, that the geographical location of each health existing health services, the distance from affected population is also sometimes hindering the accessibility. This distance between peripheral health facility and the referral system, transportation option between the different locations, the communication between those facilities, the service provided within each one, and then staff to patient ratio. These are the elements that will inform the service map to help the decision-making process better align the existing resources with the gaps that are being identified in the assessment. So now we come to the last part, which is prioritization. We do coordinate it with health cluster lead and the information management. We identify all the mechanisms of the assessment. We make sure we included the child adolescent health questions and concern and priority and areas in the assessment. We come up with this service map. What are the services available? What are where? The human resources are available, the supplies are available, and all these issues, all this information now gathered on table. Now we come up to the critical part. It's how to prioritize child adolescent health interventions, because definitely during emergency with the limited resources and the time pressure, you cannot do everything. So you need to prioritize based on the information you have. For that one, we have the health need prioritization of action from 10 responder. We are considering four elements. That the first one is adaptable prioritization. We need to prioritize to minimize suffering and adapt to changing contexts. We need to have high-risk groups focus on vulnerable children, child and adolescent population. And number three is that to have efficient resource use, balance the desire for more service with the need to reach more people within available resources. And then making sure that the working group role is to assist the lead health agency in prioritization of the services available. The actions to do that is, the first one is to have a coordinated prioritization. The health cluster lead coordinate the systematic prioritization of the health services. They need to be included in the prioritization process. They need to be part of the decision-making process, what will be are the priorities. So it's not only the working group, the health cluster lead and should be working very closely with the working group in order to do this exercise. And it is live with the working group to shoulder this advocacy process, and working with a group of also newborn, the whole spectrum from newborn to adolescent, to advocate for this prioritization, coordinating with the cluster, health cluster lead. We need to review the data and prioritization. The working group need to review the assessment finding, the morbidity and mortality data, and the service availability. So this will be the data that the working group will rely on in order to help it in prioritization. Then we prioritize based on four elements that's considered in the guide to help the working group in doing this prioritization. The first one is the most likely and the largest cause of excess mortality and morbidity. What are the main cause of morbidity and mortality from this assessment? Then what are the population group most affected? From the assessment we did, we tried to pick up what are the most affected population. Then we can come up with what are the most effective intervention reducing morbidity and mortality, and then what are the feasibility. So these are the elements that need to be used in order to help the working group along with the health cluster to prioritize the interventions. Then we need to include for inclusive assessment and strategy development, assess needs and capacity in hard-to-reach areas and at-risk groups, and develop a strategy how to include them in the humanitarian setting. Some people, they are cannot be accessible or hard to reach, so how we can have kind of a strategy to make sure that they are, our interventions are inclusive. And then assess barriers for identification of solution. Access barriers identification of solutions. Identify barriers hindering access to prioritize child adolescent services. And think practical solution how we can overcome. And this is, by the way, it's not going to happen once. It's going to happen. It's a continuous process because it's the dynamicity of the emergency itself make it's sometimes situation changing. The strategy working today may not be working tomorrow, so we need to be adaptive and how we can change our interventions. This is related also to the last one, which is adaptive prioritization. We need also keep an eye of revisiting prioritization and updating it. So an indicator for a good prioritization that the working group and health cluster lead have produced a document explaining the identified prioritization and disseminated to the health actor. So this is the nutshell of the discussion that we need to include the child adolescent health in the assessment, the different assessment tools that we walk through, and then we come up with prioritization of the interventions based on these criteria and how make sure that the health cluster lead are part of this process. These are the resources that you can find to have more division, and then also these are the tools to help you. I think you can refer to the guide where you can find more discussion into that one to have more insight into this tool, how they can work, what kind of data they are available, how to use them, how to include them, and how to link them. So the essence of this module is to make sure that we systematically engage with the health cluster lead and the information management part during the response. And as we mentioned, that this starts from the preparedness phase. We need to review the assessment tools. We need to include our questions, include our gaps, and in order to make sure that the process, when it started, child adolescent health are well included throughout the process, from the initial phase till the protractor, the closure of the response and the recovery in the future. So I hope this help you get a better understanding of this module. I urge you to read the guide very well because I think it is a very good guide that very practical to help you have a better practical understanding and at the steps, and it provide you with a lot of tools and resources to help you understand what is how you can engage at the field level. If you need any further information, these are the details for our colleague will be supporting you to have any kind of queries or questions in order to validate them. And I'm so happy that this kind of collaboration module. Thank you so much for having you here today. Wish you a very successful training